Welcome to Behavioral Health Orientation. We put together this presentation to answer your questions and to help you make an educated decision about what services are most appropriate for you. We're glad that you're here. Keep watching and I imagine most of your questions will be answered. Keep a notepad handy. And if you think of questions that are not answered, we'll provide you with additional contact information at the end. This will help you know who to call to get those questions answered as well. Often, service members come to behavioral health because they're having a bad day. But once here, they're not really certain what we do or what services we have to offer. In addition, we also find that they are not aware of other services across posts that might also be helpful, or in some cases, be even more appropriate for the concerns that they're having. The most common reasons people come to behavioral health include difficulties with acute life circumstances, things like relationship problems, difficulties at work with leaders or peers, sleep problems, stress with family back home, alcohol or drug use issues, or just difficulties adjusting to Army life and expectations. Although not common, some service members may have struggled with serious behavioral health issues prior to joining the Army, but for one reason or another, never had the opportunity to really seek treatment. Some service members have never struggled with these problems before joining the military, but now find themselves struggling with depression, anxiety, having experienced a significant traumatic event, or experiencing other psychiatric symptoms that are completely new to them. Any or all of these problems may be appropriate reason to seek supportive resources. We mentioned that many people seeking behavioral health don't necessarily have serious behavioral health disorder, but rather are struggling with the normal and expected stressors in life, like relationship breakups, stress at work, stress with their family, spouses, or children, sleep difficulties, anger management issues, or just difficulties in finding and making friends. In these cases, there may also be other resources on post that you might want to consider. Some of those resources include programs like Chaplain Service, Military Family Life Counselors, the Army Wellness Center, Army Community Service, and Military One Source. The chaplains are often thought of as a place for spiritual guidance, and they most certainly are great for this. But in addition, they host single soldier events to meet new people and make new friends. Marital retreat weekends for couples, they provide grief and loss counseling, and they often can be a great assistance to soldiers who are struggling to find their place in a new unit. Never underestimate the variety of stressors your battalion chaplain can be of assistance to you. Often he or she is just down the hall and they're able to talk any time of the day. Certainly, for your convenience and access, your chaplain can be your go-to support. Keep in mind, chaplains are generally trained in some counseling, and if he or she feels the concerns you are presenting are beyond his or her scope of support for you, they'll help align you with a behavioral health resource that is where you really need to be. Also, we have the Military Family Life Counselors. Each brigade typically has their own aligned MFLAC. And these are licensed professionals in counseling and in social work. They provide counseling and assistance right in your footprint and can assist with first-tier concerns like relationship issues, work, family stress, sleep, and anger issues. The beauty of the MFLAC program is that they're designed to be your go-to resource when you need quick pick-me-up and a good ear to listen. They also generally have exceptional availability. More often than not, when you call to make an appointment to talk with them, they will be able to see you within 24 hours, many times on the same day. Your MFLAC counselor can be that touchpoint person who you might see once or twice and then move on with your life. But if a new problem arises, they're still there and you can always go back to check it as needed. More structured resources that may also be helpful include the Army Wellness Center. Here they offer structured classes on stress management and sleep hygiene. These are great resources for those of you who are more self-starters. If what you need is some good information so you can take off on your own and manage your own issues, the Army Wellness Center may be for you. In addition, they offer biofeedback, which is a fantastic way to teach your body and mind to relax. It is a go-to intervention for anxiety and stress. And the Army Wellness Center is the only place on post this is offered. There's also the Army Community Service, and they offer a variety of different services that can really help out with life stressors. They can support positive stressors like starting a new family. The New Parent Program is a perfect way to ease into the start of adding into your family. ACS can provide classes on relationship issues, communication skills, anger, and conflict resolution. Again, many times what we need is information, not therapy. We need to learn solid information to help us support our own behavior changes, and ACS is there to help in many of these areas. Lastly is Military OneSource. Sometimes strength means asking for help. Military OneSource connects service members or their immediate family members that need help, whether it involves confidential behavioral health counseling, spouse education, and career opportunities. Matters specific to families with special needs, financial or tax counseling, or other important issues. Military OneSource offers one call center and online support to connect you to the program or professional to make sure you receive the assistance you need. I know we just reviewed a number of options for assistance beyond what behavioral health offers, and we'll provide you with all these names and contact information for each at the end of the presentation. But for now, what we really want you to know is whatever you may be currently going through, there are a wealth of resources available to you. While behavioral health may be the most appropriate option for you, one of the other resources on post may be as well. Units do a great job of assisting us in sharing behavioral health resources. But sometimes other support services might not get the same spotlight and may actually be more of what you're looking for or need. So while we have given you some information on alternative resources that may be helpful, let's dive into behavioral health itself. Behavioral health services here at Fort Campbell are spread across post, with 5 embedded behavioral health clinics, the main behavioral health clinic department at the hospital, an intensive outpatient program, child and family behavioral health services, and an inpatient unit as well. In addition, the family advocacy program is also part of the Department of Behavioral Health. Our outpatient clinics are open from 0730 to 1600 daily. Remember, just like all medical appointments, keeping your behavioral health appointment is your responsibility. If you schedule an appointment but don't show up, it'll be documented in your medical record as a no-show. So make sure you know when and where your appointments are. And if you ever think you might be late or if you need to cancel or reschedule your appointment, make sure you do that prior to the date and time of your appointment. Once your scheduled date and time are here, there's no way to cancel an appointment, and it may be marked no-show. Generally speaking, anytime you do not present as scheduled for your appointment, our providers will try to reach you by phone. They generally will offer you an option of coming in late if you have simply forgotten your appointment. Virtual appointments are no exception. Not only is it important that you are ready and on time, but it's important that you are not engaged in any activities or preoccupied by distractions. For any virtual appointment, we encourage you to be in a private location where you can talk freely. Be dressed, awake, and ready to receive your phone call. We know when you are in your room or at home, it can be tempting to multitask. But during your appointment is not the time for this. So be ready, be in a quiet, distraction-free environment, and ready to focus on your time with your provider. For those of you that have never been to behavioral health, it is also important to know that in each sessions, you'll be asked to complete several screening questionnaires prior to each appointment. These help our staff better understand what difficulties you may be having and monitor over time if our treatment is helpful. These screenings may be given out as a paper and pencil forms, but more generally, they're administered on a computer in the waiting area, or even remotely on your phone or computer. Keep in mind that you'll need to complete these prior to being seen. So if you have a 9 o'clock appointment, you will need to arrive in the clinic by 8:45 to ensure you have time to complete these. Also keep in mind, the very first time you complete these screening questionnaires, it may take longer. So for your first appointment, we recommend you arrive in the clinic 30 minutes prior to your scheduled appointment time. One of the biggest questions everyone has is about confidentiality. This relates to who gets to know information about your visits, who can release these informations, and what type of information can be released. First, it is important to know, almost always, your privacy is our priority, and we generally share very little about your visits with anyone outside of your medical team. However, there are a few situations where we have to share information, so let's make sure we cover these exceptions. The biggest area that people are concerned about generally is what we tell your commanders. Generally, the answer is nothing. There are, however, situations we may release information. For starters, your command always has the right and need to maintain accountability for where their soldiers are. So, if commanders call and inquire if his or her service member is in our clinic or have been on a particular day and time, we can and will release that information to them. In addition, we are bound by law and ethics to protect the safety and well-being of our patients. So if you make your provider aware that you are a danger to yourself or to someone else, we will do everything in our power to protect you and others, which may mean releasing information even without your permission to do so. Certainly, anytime a service member needs to go to an inpatient facility or be hospitalized, command will be made aware. We are also bound by law to report all known or suspected abuse. If you make someone on our team aware of a situation of child or dependent or spousal abuse, or where we even have a reason to suspect this may be the case, we are required to report to the Family Advocacy Program so they can follow up and ensure everyone's safety. While we do not specifically report legal violations, you are encouraged to consider what you might want to divulge to your providers. While we do not report these to authorities or command, if CID were to believe we may have known, they can make efforts to secure our records and talk with your providers. This is not to say we just hand the information over, but in some cases, we can be ordered to do so. Lastly is substance abuse. In general, this is considered a treatment issue for behavioral health. But if your provider is concerned about your substance use, they may make a referral to substance use disorder clinical care provider. If it's determined that you need enrollment in that program, your command will be made aware of your participation. We would always encourage you to be honest about your substance use, as substance use can significantly contribute to other behavioral health issues as well. At times, your command may also be alerted if your substance use is interfering with your ability to safely perform your duties. This brings us to the final issue of confidentiality that pertains directly to you being in the military. We do and must make command aware if your behavioral health issues jeopardize the mission, impair your judgment or reliability, impact your ability to hold or maintain a security clearance, or simply impact your ability to function in your given role in a military occupation specialty in some way. Generally, this is done via profile limitations that may limit your duties in some way, but could also involve more direct communication with your command. Keep in mind, even though we just discussed all the exceptions to confidentiality, generally speaking, we rarely need to disclose information to anyone, and these really are more the exception than the rule. Even if we do disclose information for one of the previously mentioned reasons, it always follows these simple rules. 1. Release is necessary to maintain safety and mission readiness. 2. We release only the minimum amount of information necessary. 3. We will generally always inform you before we release any information, unless unable to do so. I know we just went into a lot of detail there, but we want to make sure you understand how and when your information is protected, and when it may not be. So those are some of the details about behavioral health, our clinic and policies, but what do we actually do, and what services do we offer? Generally speaking, our behavioral health clinics offer the following services: crisis walk-in, group therapy, individual therapy, and medication management for behavioral health issues. Let's look at each one of these one at a time. Crisis walk-in is just as it sounds. If you find yourself in a crisis, having suicidal or homicidal ideations, having an acute crisis, or in need of an immediate intervention, you can simply walk into the assigned clinic anytime between 07:30 and lunch, and after lunch hours until 1600. At these appointments, you can generally expect to meet with two different people. You will initially be seen by a psychiatric technician. The technician will talk to you about what's going on and what has led you to come in. The technician will assist for safety and ensure that you're stable and not in need of a higher level of care, such as hospitalization. After this initial meeting, the technician will then talk with the licensed provider and give the background of what has brought you in for the day, and will communicate any concerns they had about your safety and stability. You will then meet with one of our providers who will do their best to ensure the accuracy of the assessment, and then will work with you to reduce the urgency of the crisis. This could include teaching you quick new skill, helping you establish ongoing care with the clinic, or if needing help to get you admitted to inpatient care and ensure your safety. What happens at this point is really dependent on what brought you into the clinic. Individual therapy is what most people think of when they come to our clinic. These sessions are typically about 45 to 50 minutes in length and can take on many different forms depending on your needs. Group therapy is provided in the context of a group, and most clinics strongly emphasize the use of group therapy. Generally, groups contain between 5 to 10 service members, and they are often organized around a particular topic or skill area. These may be anything from general therapy groups where people come together to speak with one another about what they're struggling with, to more skill-based groups such as cognitive behavioral therapy for depression, a coping skills group where you may learn new techniques each week to help manage general stress or anxiety, or anger management skills. These groups are tailored to problems that most commonly see in our clinics. We really encourage people to think about attending group therapy whenever possible. Let's look at two service members who both came in with depression. PV2 Smith only wants individual therapy and is unwilling to consider attending group. He is assigned a therapist, and 2 to 3 weeks later, he has his first appointment. Over the course of the next 3 months, PV2 Smith gets to see his individual therapist about once every 3 weeks. After 3 months, he has had a total of 4 therapy sessions. PV2 Jones, on the other hand, is also scheduled for his initial appointments 2 to 3 weeks out. At this first appointment, he talks with his counselor about what's going on, but he agrees that perhaps group therapy might be helpful, so he's enrolled in a weekly group that addresses depression. At the end of the 3 months, he has had 1 initial visit, 12 weekly group sessions, and a final follow-up with his individual therapist to check on progress. At the end of his 3 months, he has had 14 total sessions. In the end, who do you imagine will do better? PV2 Smith, who has 4 sessions, or PV2 Jones, who has had 14? As you can see, we encourage group therapy because it works. It is more consistent, and you have more opportunity to address your concerns quickly. I know everyone believes in group. Talking with others they don't know will be uncomfortable. But in reality, many people in our groups find they prefer groups over individual therapy. They feel there are others in the group they can relate to. It helps them to know that they're not the only ones struggling, and in some cases, they find new friends and support among those who are in the group. Lastly, all of our outpatient clinics also offer medication management for behavioral health disorders. Often, if you have never been on medication, you may be asked to schedule with your PA first time. Many of the medications we use initially are safe and have a few side effects. The PAs are generally comfortable with giving you these medications, and you can see them sooner than going to one of our specialty providers. However, if you've been working with your PA for a while and have not been getting any results, we can discuss about getting you with one of our specialty medication providers. At Behavioral Health, we also like to set realistic expectations. Typically speaking, when you visit your behavioral health care provider, you get out of that experience what you put in it. Just as when you go to physical therapy, they will give you exercises to work on in between your actual appointments. and your behavioral health team would likely give you homeworks or assignments to work on in between sessions. There's nothing magical about behavioral health care. Making behavioral health and emotional changes is difficult, and it will require you to do some work on your own. Based on some questions and feedback we have gotten in the past, we also want to set some other expectations up front. Often, service members may attend behavioral health sessions thinking we can do things we simply cannot. So please keep in mind, while we want to help and support our patients, some things are simply outside our control. These tend to be things like getting you moved out of your company, helping you change your MOS, helping you avoid negative consequences to previous choices you may have made, getting you out of the Army simply because you no longer want to be in the military. While we realize most people are not coming to behavioral health for any of these reasons, there are those times when it is what someone is hoping we can do for them. So we just want to make sure that we do not disappoint you. Hopefully, you now have all the information that you need to decide if attending behavioral health appointment is the right choice for you. You are aware of other resources on posts that are available to you, and you know about what they do. You also know how our clinics operates, when and how you can reach out to us and make contact. Now it's just time to decide if you still feel like behavioral health is the right service for you. If so, that's great, and we look forward to helping you as much as we can. Our providers love working with active duty soldiers and take pride in giving back to those who give to our country every day in their service.